Why is high cholesterol important?
High cholesterol is a condition that leads to plaque formation in the vessels in the body, specifically the arteries. And this can cause problems with blood flow to various organs. And it's very important to address this because treatment with certain medications can reduce the plaque formation process and in turn can reduce the risk of strokes and heart attacks. And it can also reduce symptoms related to those conditions.
What are the consequences of abnormal cholesterol numbers?
High cholesterol generally include buildup of plaque in the bloodstream, and that is specifically in the blood vessels. And high cholesterol can lead to plaque formation in all kinds of distributions. If it's in the carotid arteries, that can lead to mini strokes or strokes. If it happens in the arteries called the coronary arteries going to the heart muscle, that can lead to symptoms of chest pain, shortness of breath, or heart attacks. If it affects the arteries going to the legs, that can lead to symptoms of pain or weakness or fatigue with walking. And all of those symptoms are indicative of significant blockages in those vessels.
What treatment options are available for abnormal cholesterol?
Treatment options for elevated cholesterol include, most importantly, diet and exercise, and we do emphasize the importance of a very low-fat diet. There are some modifications that can be made specifically tailored to individual patients. We also encourage daily aerobic exercise, and that has been shown to reduce cholesterol numbers and improve low HDL, which is an important risk factor to address. And it also improves body weight. And healthy exercise routines also reduce the risk of heart attack and stroke over time, which are things like simvastatin and atorvastatin, and they're generics and also brand name medications that can reduce the LDL cholesterol and also the triglyceride numbers. A more controversial question is whether or not raising the HDL, which is the good cholesterol, is beneficial. And we do have medications that can do that, but there is still controversy as to whether that's beneficial or not. So we really try to emphasize, most importantly, heart-healthy eating, and then exercising, and then medications where appropriate.
What is the purpose of the lipid clinic?
The purpose of the lipid clinic is to address both educational needs of the high cholesterol patient and then address treatment needs as well. We have a lipid clinic nurse who sees patients on a regular basis, and she looks at cholesterol questions with the patient. She looks at cholesterol numbers as well, and she offers advice on how we can reduce or improve cholesterol numbers depending on specific numbers that are looked at day to day. We also have twice monthly a class that meets where we address questions of cholesterol management and, more importantly, things that patients can do to improve their cholesterol numbers. And that class includes things such as how to read a grocery label and what contents are in the on food labels, and we also address things such as treatment modalities such as medications in our lipid clinic.